Here is a great case of using dermal fillers to fill in a nasolabial fold as well as an oral commissure. So let's go ahead. Patient has been cleaned off very well, and now you're going to see some of the AAFE tips and tricks as to how to do this successfully. So first of all, you must know your anatomy. That's first and foremost. You must have training in this, and you are going to look for the mid-dermal plane to place these dermal fillers. These are hyaluronic acid dermal fillers, and you want to be in the right plane. That is so crucial to get, number one, the best effect, but also for safety. And you're going to see right before your eyes this fill up and using the AAFE Safe Injection Perfection Protocol here. And you can see, here's one of the little tips that we use all the time is keep testing that fold. And you're going to see as we fill it up, first of all, you see exactly where the fold is, but as you pinch it, you go ahead and fill up that area. And we're going to come back again and do a little bit more trying to fold it, and you'll see the resistance of a dermal filler in that area here. And that's what we keep going ahead and doing, is testing that area. And you can see just with that little bit of hyaluronic acid based filler, we are going to start seeing this start to fill up just beautifully. Safety is key. You must know the anatomy. You must keep that needle moving at all times. You've got to do some aspiration. You've got to go ahead and only give a little bit of filler at one time. But here's the big key. The big key, and here you can see we're testing that fold again. Doesn't take much filler. Oh, definitely have the patient go into different motions so you can see how the filler integrates with the tissue and moves around there. So one of the big keys though is to make sure that you are always watching the tissue here. Watch that tissue to make sure, because if you would get any kind of vascular compression or vascular occlusion or event, then that tissue will change color here. Here we are now doing the oral commissure. Let's pick up the corner of that lip to make it nice and straight as you see on the other side, and that's exactly what we're doing here. And again, it doesn't take a lot of filler. This is mid-dermal injection. We are going to go actually perpendicular, as you can see, to the oral commissure, to the fold that is developing, and that is going to turn this frown upside down by adding some filler on the sides of the lips to go ahead and bring that up. One of the signs of aging for any age, or just one of those areas where people don't look very nice, is when they are at rest and they've got downturned corners of the lips, which makes it look like they are frowning or not very happy, where other people will say to them, you know, what's wrong? You don't look very happy today. And you can see that has fixed itself here with some great placement of dermal filler. Here we are testing the area again. Once you've replaced some volume, you can see a little bit of swelling and edema that is happening and redness as a result of these injections. The patient will go ahead and heal up very, very well. Now a little bit of extra to make sure that we get the filler right underneath the top, the oral commissure, but right underneath the lower lip corner, because then we can really push that up. And that's what you want to go ahead and do, is go ahead and push against gravity here. So all this comes with great training to really know exactly where you should place this and how to place it safely. Now, what are we doing here? This is, I can tell you, one of the most important parts of the procedure. And after you've placed some of this, but now it's about smoothing it and getting it to be exactly where it should be and where you want it, so there are no lumps or bumps or anything else here. Smoothing is the key to perfection and getting this to where you want it here. And it's an art in itself, and it is certainly part of the training, is how to really smooth this and manipulate the material once it's in there for optimal aesthetics all the way around. You can see that looks beautiful. We never get rid of nasolabial fold. Patients naturally have some nasolabial fold, but that has really filled up. Some water will start to get there, as these are hydrophilic agents here, and some water will fill in, and that will be a beautiful final result in a day or two, as you can see right here, once it's all well and healed up here. So these are great techniques. It is time for you to get AAFE certification trained today and give your patients what they want, which is really beautiful aesthetic results.